Hi, I'm James Williams, Vice President of Diversity, Equity, and Inclusion at University of Chicago Medicine. Today, we're going to take our new residents on a bus tour so they can get to know their new community. And we want to take you with us, so let's go. The South Side boasts a rich cultural history. It was the site of the famed 1893 World's Fair, the birthplace of Chicago blues, and the one-time host to the illustrious Union Stockyards. Community engagement permeates all levels of the institution, from medical students at the Pritzker School of Medicine to residents and fellows to faculty.
Students are immersing themselves in the community, going out with partners and in groups to actually engage with community members. In addition, they also have the opportunity to serve in one of 6 student-led free clinics.
I came into the process knowing that caring for the Southside community had been the highlight of my medical school education.
Graduate medical trainees too embed themselves in the Southside community, starting with their history lesson on wheels.
I'm sure when you told folks you was getting ready to do your medical residency in Chicago at O Block, they like, what? Like, you know, it was some folks had something to say, I'm pretty sure.
Half of the people in Chicago who live in food deserts live within our community service area.
As you're on the bus with me, count how many places you think you can buy an heirloom tomato.
Trainees and healthcare professionals at the University of Chicago work in partnership with individuals and organizations in the community to understand their unique needs and design programs and opportunities to address them.
U Chicago Medicine's GME's Community Champions program is one of a kind.
Every 3 years we conduct community health needs assessments. Our community has identified 3 priority health needs.
Mental health as number 1. Next thing was violent crime. Next thing was access to healthy foods. And then after that it was diabetes and obesity.
One of the things I think that's very important when you work in healthcare is realizing you serve the community, but you're part of the community, and you have to work in the community. You have to understand what the community needs.
Specific programs and interventions are informed by community feedback, immersion in the community, and organized groups like the University of Chicago Community Advisory Council.
As part of the community, it's essential that we listen to the voices of our community. We do that in various ways.
We do a lot to make sure that we are listening and hearing our community. We have a long-standing Community Advisory Council.
As the Southside community continues to evolve, so too will the University of Chicago's commitment to it.